Good morning, everyone, and welcome to our webinar for Mental Health Awareness Month. I'm Johanna Dunlevy with Employee and Family Resources, and I'm very excited to have with us today Megan Hammes. Megan is going to be sharing Building a Resilient Workforce, the Platinum Standard for Mental Health Training in the Workplace. Megan, welcome to the webinar, and thank you so much for your time today. I will turn it over to you.
Okay, sounds good. Thank you so much to Joanna and EFR for hosting this event. It's wonderful to see so many people joining on a beautiful day in Iowa. I'm Megan Hammes, and I'm the owner of Hammes Homestead and Consulting, also an Iowa-based company. And today we are going to talk about mental health awareness training programs with a specific focus on the training titled Mental Health First Aid. So first we'll just talk a little bit about why workplace mental health awareness trainings, why is this becoming more and more popular to offer to employees, and then what types of mental health awareness trainings can you trust as kind of endorsed and verified. And then again, we'll dive into mental health first aid, and we'll have time at the end for some discussion and questions. So kicking it off, many of you probably know a lot of the reasons why we should offer workplace mental health awareness trainings, but really it's to help normalize conversation around mental health challenges and mental illness because they're so common, with 20 to 25% of adults experiencing a challenge with mental health. In the workplace, we are so connected with one another, ideally, because we spend such a large percentage of our time with one another, that in the workplace, we're very well positioned to identify mental health challenges early and therefore connect to care earlier. So that is a huge part of why employers should be doing mental health awareness trainings, is because the workplace and coworkers are often the first to notice changes. Of course, the more we offer trainings and increase people's knowledge, the less stigma exists around disclosing a mental illness or a mental health challenge and also seeking care. So as many of you know, a lot of workplace factors, both positive and negative workplace factors, things like staffing levels, appreciation, workload, go a long way in contributing to well-being, again, either positively or negatively. And what we do know is that here in our country, 73% of employees say that some type of work-related mental health struggle has hurt their performance at work. I also want to mention that mental health awareness trainings are, of course, just one piece of the puzzle in supporting our employees. Other pieces of the puzzle include employee first workplace policies, such as paid time off, intermittent flexibility when people need to tend to their life, and then access to professional support like EFR, so that employees know, okay, I know it's important to seek help, but where do I go? And are my financial barriers removed or somewhat eliminated for me? So again, mental health awareness training is just one piece of kind of the overall strategy for employee mental health. And I felt really compelled to include this slide. This is from our former Surgeon General, Dr. Vivek Murthy, one of his awesome landmark reports, this one from 2023 on loneliness and isolation. And the three graphs that you're looking at show a decline or a decrease anywhere from 6.5 hours a month up to 20 hours a month in terms of our interaction with others, whether that's people outside of our household or social engagement with friends. Over the last 20 years, we've seen a rapid decline in our connection with others. And I just think this further kind of drives home the business case for why in the workplace, whether we're an in-person workplace or a remote workplace, why coworkers are so well positioned to identify mental health challenges. All right. So, what are some of these endorsed mental health awareness trainings? The three that I have on the screen are from an advisory that SAMHSA put out a few years ago, SAMHSA being the Substance Abuse and Mental Health Services Administration. And you can Google this paper. It's called the SAMHSA Advisory on Mental Health and Suicide Prevention because they go into a lot of detail about these three programs, um, certain offshoots of these three programs. So, for example, mental health first aid has offshoots for colleges and universities, fire and EMS, rural communities. There's a youth mental health first aid module. So the paper goes into kind of all of these offshoot programs as well. But the first one that is endorsed and recommended is a 60 to 90-minute training called QPR, or Question, Persuade, Refer. This is specific to identifying warning signs for suicide. Mental health first aid, that's what we'll talk a lot about after this slide. That is an 8-hour training from the National Institute for Mental Wellbeing. And this is really what's considered the platinum standard. And we'll see in a minute why. Very, very comprehensive. And then another training is called Assist, and Assist is a full 2 days, and this is from a group called Living Works. Assist is an extremely in-depth, wonderful training, very specific to crisis intervention and suicide. So a lot of our peer support people will be trained in Assist. Many of our mental health professionals as well will be trained in Assist. So again, very focused on preventing suicide. All right, so let's take a look kind of inside what mental health first aid is and what it looks like. First and foremost, it's been around for a while. So mental health first aid was created in Australia in 2001 by a nurse and a mental health literacy professor. And since then, it has been expanded and adapted by 25 countries around the globe, which is truly amazing. So for people who go through mental health first aid, they see the little koala bear quite a bit. And the koala bear's name is Algae. And why the koala bear is called Algae, we'll get to this in a minute, but Algae is the 5-step framework called the Mental Health First Aid Action Plan, the framework that is really used to intervene. So some of the logistics, the nuts and bolts of adult mental health first aid, as mentioned, it's a full 8-hour training, and that doesn't include our breaks and our lunches. Instructors can teach mental health first aid over the course of 1, 2, or 4 days. And when I'm working with clients, I almost always advise to do it in 2 or 4 days. And the reason for that is because the latter part of mental health first aid is where we focus on crisis intervention, including suicide. And if it's 3 o'clock in the afternoon, and we've already been talking about mental health, mental illness the entire day, and now we're just getting to crisis intervention later in the day, it's hard. It's really hard to remember. It's really hard to focus. And not to mention, this is often a hard topic for employees to shift from work mind to now all of a sudden talking about an unfamiliar topic, which is mental health. So instructors will teach any way that you want, 1, 2, or 4 days, but I like to advise, let's break it up so the brain has a little bit of time to digest all of this content and information. Mental health first aid can be delivered in person or virtual. Group size needs to be between 5 and 30 adults. So oftentimes a larger company will say, well, how do I choose who should go through it? And there's a lot of different options we can talk about with that. My recommendation, unless your company culture is very much, well, we're requiring this class and you do that for other things, my recommendation is to work with the willing, people who are very, very interested and motivated to take a class like mental health first aid are probably the best low-hanging fruit. But I also see companies saying this is very important for our supervisors, managers, and leaders. And I think that's a fine decision as well. When an individual completes mental health first aid, they then earn a certification that's good for 3 years in their called a certified mental health first aider. So upon taking the course and completing a short quiz, you get this certification. And for those of you who have done CPR first aid training, it feels a lot like that, very similar certification. One thing I should mention too, with that certification, very much like our first aid and CPR, for those of us who are not physical health professionals like doctors or nurses, we only have a duty to act. Good Samaritan laws explain this. We only have a duty to act when we feel like we can, when we feel like we're capable of intervening and helping. Mental health first aid is the same way. So once somebody's a mental health first aider, they do not have a duty to act unless they really feel compelled that they are in a position to help themselves from a health and well-being standpoint, and that their relationship with the person is such that they can be an effective mental health first aider. So for workplaces thinking about sending people through mental health first aid and then saying, oh, this is a part of your job now, that's probably not going to work. So continuing on, mental health first aid helps us to identify, understand, and respond to signs of mental health and substance use challenges amongst adults. And then the 5-step action plan or framework that we use is termed ALGE, just to help us remember it. And some of the goals and objectives are to reduce stigma and discrimination, improve overall psychological safety, address mental health and substance use challenges early, but then also when they're worsening and in crisis situation. And like CPR, we as mental health first aiders provide these skills until more help arrives. And then mental health first aid all throughout the course acknowledges what is our scope as a mental health first aider. This is definitely not a substitute for professional help. Rather, we are a connector to professional help, like an employee assistance program. This is the course outline, and it's broken up into part 1 and part 2, not because I think it's a good idea to break it up into a day 1 and day 2, but this is just the way it's outlined because we know learners need a break, a really good break in between part 1 and part 2. So we start off, welcome, introduction, make sure everybody's comfortable. There are 2 learning materials that go along with the course. There is a manual, and that's almost like an encyclopedia. Does everybody know what an encyclopedia is? Hopefully I don't need to explain it, but you can Google it. So a manual, and it's a reference book. It's pretty thick. There's over 300 citations in the manual, and then a smaller book, and that's really a workbook. It's called the Participant Processing Guide. And from start to finish, that workbook gets filled in with all of the things that we're learning, but it gets filled in the learner's words, how the learner is digesting the information. So that's the welcome. And then we do a fun activity where we talk about mental health, mental disorders, and common mental disorders in the US, where we use our manual and we do some teach back. So it's very, very interactive, where all of us in the room, whether it's in person or virtual, we learn about different common mental illnesses like depression, like eating disorders, like post-traumatic stress disorder, substance use disorders. I tell my learners, I learn something every time we go through the class, because what different groups pull out of their assignment to study the mental illnesses, they're pulling out different facts, and some of which, even though I read the manual, I had forgotten. And so it is a highly engaging, very, very much a learning atmosphere. Okay, so in part 1, we continue on then with recognizing signs and symptoms, all the way from early signs and symptoms of a mental health challenge down the road to when things are worsening. And we do a lot of practice around, well, what do those signs and symptoms look like, feel like? How do we notice them in the workplace? Next part of the class is highly geared towards using that ALGE framework, mental health first aid action plan, and applying it to different scenarios. So as a class, we watch some different videos provided as a part of the curriculum. We break them down, we use our noticing skills, We talk about how the mental health first aider responded, what they did well, what maybe wasn't as helpful. And then as groups, we walk through scenarios and really practice the LG framework, and we practice our skills, and we practice what feels natural for us, because we're all different, and our situations might be all different and unique, and we just have different ways of approaching things, and that's 1,000% okay. So that really rounds out the course. And one of the reasons that I really fell in love with the curriculum and that I became an instructor for mental health first aid is a high focus on prevention, a high focus on self-care for everybody as a preventive tool to help prevent mental health challenges. But then also, when we are experiencing mental health challenges, or when we are having a recurrence of a mental illness, self-care is something that we need to deeply rely on to help us move forward and recover. And so I love that it places a high focus on self-care from a standpoint of maintaining our health, but then also recovering. And we talk quite a bit about that in the class. And then we talk about how, as a mental health first aider, being in this support role can often be challenging. It can be exhausting. It can be scary as well. And so we talk about how, with maintaining confidentiality of the people we're helping, how can we debrief? So that we're getting some good, wise counsel and support ourselves as well. Okay, so I've been talking a lot, so I am going to ask for your help in the next couple of slides. I have four. Is it 3 or 4? Hold on, let me look. I have 3 statements, and they're either a myth or a fact. So if you can use the chat feature to let me know if the statement is a myth or a fact, then I'll reveal the answer and explain a little bit more. Is everybody ready? Okay, here we go. So the first one, myth or fact, mental health first aid skills are, quote, common sense, unquote. Is there anything in the chat, Joanna?
Yeah, we see some myths, or I
Okay.
see some myths. They're
Okay, very
rolling
good.
in.
I should have known. Everybody knows the right answer. Yeah,
We're
I just
passing
can't
the
see the chat.
test.
So I have no doubt everybody will pass the test. I'll just, yeah, especially this audience, I have no doubt. So you're right, it's a myth. According to a poll conducted in 2022, 75% of US adults report not feeling comfortable or only feeling somewhat comfortable discussing mental health with loved ones. Factors that impact an individual's level of comfort when discussing mental health include stigma, being uncertain about how to approach someone, and what is appropriate to say. So the content and activities in mental health first aid provide participants with a really safe place to practice responding to signs and symptoms. So much of this might really seem like common sense, and some of these skills, I bet, come very naturally to many of you. But the facts are, a lot of people don't feel comfortable or confident discussing mental health. We see in data from mental health courses that learners have an increase in confidence and an increase in knowledge almost across the boards after participating in the class. Okay, next one, myth or fact, mental health first aid is for crisis and non-crisis situations. Yes, that is a fact. So the skills learned in mental health first aid can be used to provide assistance to an individual in crisis and non-crisis. There is a high emphasis on early detection, and we use that ALGE action plan all throughout. Without help and that early intervention, we know that untreated or unchecked outcomes can be very, very serious with mental health challenges. Employment, ability to stay in school, ability to keep healthy relationships, carry out daily activities, et cetera, et cetera. And so just like with our physical health, how we know outcomes can improve if we catch things early and we start getting treatment early, same is true for our mental health. All right, last one, myth or fact. Talking about and training people in mental health awareness causes more people to label day-to-day stressors as quote unquote mental illness. I feel like this one is a little bit trickier, but this one is a myth. So when people are trained to talk about mental health challenges, we increase knowledge all around and we help provide people with a common language to discuss mental illness and mental well-being overall. Many people, especially our younger generations, are more open to discussing mental health. However, not everyone has that same knowledge and language and confidence to do so. Have a quote in early 2024, a mental health first aider told the National Council for Mental Wellbeing, "My mental health first aid training has helped me have the courage to ask the question, 'How are you doing?' and to deeply listen to the response, to hear what is not said and what is said, to create a space for sharing, to encourage the people in my life to practice self-care." So those are the types of comments we hear from mental health first aiders. So as mentioned, there are some community-specific classes. It's still adult mental health first aid, the same certification, but the curriculum and slides are adjusted slightly to be specific towards some of these groups that experience different stressors or higher than usual stressors in the workplace, rural communities, military veterans and their families, higher ed, so on and so forth. You can read the slide. And then outside of the scope of today's webinar, there is a youth mental health first aid. That's for adults who interact with youth aged 12 to 18. And then there's a teen mental health first aid, and that's for teens in grades 9 through 12 to help each other. So those resources you can find at mentalhealthfirstaid.org, but they're just a little bit outside of the scope of what we offer at EFR. So outcomes and impact, one thing you can expect by offering a mental health first aid training is an outcomes and impact report. And that is because learners are required. So the National Council for Mental Wellbeing has an infrastructure set up where there's a little bit of pre-work and a little bit of post-work so that we can get some data on the participants, so some changes over time in knowledge, attitudes, etc., and then also some really good feedback on the course. So it's highly likely you're going to see some awesome quotes about the training and the curriculum, and you're going to see a very, very high percentage of people who agree that the course was delivered effectively, and that also that they are more likely to help an adult who they've identified as experiencing signs and symptoms of a mental health challenge. So you'll definitely get some nuggets to share back with leadership or include in an annual report, add into all of your other mental health benefits that you're offering for your employees. And I think now Joanna is going to talk a little bit about how EFR offers this program and cover a few things there, and then just reminders about what EFR offers.
Thank you, Megan. This is an opportunity for anyone who is on the webinar to drop questions or comments into the chat. And at the very end, I will turn it back over to Megan to answer any questions you may have about the topic today or mental health first aid training. So I just wanted to remind everyone who has joined the webinar, whether you have EFR's EAP benefits or not, we are available to come into workplaces and organizations and provide workplace trainings, and mental health first aid is one of those trainings. And here you will see a description of the training as well as the course objectives. Now, Megan went through a lot of this information today, and so you can reference our website for this information as well. So if you go to efr.org, you can find this information under our Your EAP Benefits menu, workplace benefits, you'll find information about workplace training. But like I said, if your organization currently does not have EFR's EAP, you can still partner with us to provide this and other trainings in your workplace. The next couple of slides are specific to those with our benefits. And if you have our EAP, and oftentimes most of the people who join these webinars have our EAP benefits, you are able to call us 24/7, chat with us online, or use the EFR mobile app to get in touch with us. We always encourage people to reach out. There's a suite of benefits available, and you can scan the QR code here to head over to our website and find more information about all of these benefits, but lots of great resources for you and your household family members to access at any time. As I mentioned, there is that 24/7 phone-based support, but we also have things like in-person or virtual counseling, life coaching, legal and financial consultation, elder and child care resources, identity theft assistance, and we have an online peer support platform called TogetherAll. So it's a lot of information to take in this webinar, and we don't have time to go through each benefit line by line, but you can scan that QR code and it will take you over to our website where each of those benefits listed here has more information. And the nice thing about our website is you can access the chat function to chat with one of our phone center counselors if you have some questions about using the benefit. Our next webinar is in August with Molly Mackey, and it is Boost Your Battery, Setting Boundaries and Finding Balance in Your Personal and Professional Life. Another QR code makes it easy for you to scan and head over to our website to register for this webinar. It is Wednesday, August 19th at 10 a.m. So please visit our website, get registered for an upcoming webinar, and consider booking a mental health first aid training with us. We do have some questions.
Great.
So we have a question. Can you remind us what LG stands for?
Oh, algae. Yeah. So A is assess the situation for safety, basically. And then it also stands for approach. So how are we going to approach somebody about the changes we're noticing? So that's A. L is listen non-judgmentally. G is give reassurance and information. So G's tricky because it's two things, give reassurance and information. And then E1 is encourage appropriate professional help. And E2 is encourage self-help and other support strategies. And so there's a model, and I can't share it because some of the things are reserved for training only. But it's a non-linear model, and we go over this a few times in the training to really help the learners solidify it, that all of these steps don't need to be used. They don't need to be used in a certain order. They're just the framework and the ways that we work with an individual. Yeah, because situations are so nuanced and so different. Once we become certified in mental health first aid, it's like we start noticing new and different things that otherwise we might not have paid much attention to before. So that's a great question.
Thank you, Megan. I do have a couple of questions related to benefits. So what information is needed to ensure that we can be identified as being eligible for services? This is a great question. When you call EFR, all you need to let us know is that you work at such and such employer, or I'm a family member of someone who works at the organization with our benefits. So what we do with that information is we verify that your organization, or maybe it's your spouse or partner's organization, has EFR's EAP benefits, and then we continue into a short intake over the telephone where we collect other information. But you just need to let us know who your employer is, or if you're the spouse or partner of someone with EFR's benefits, let us know who their employer is, and that is all we need to identify you as eligible for services. And then another question just related to trainings when EFR comes on site to the employer. This is a question related to cost. Is there a cost to come on site? And there is, and the best thing to do in this situation is for an organization to contact their account manager. So the account manager at EFR is the person who can help answer questions related to coordinating and scheduling trainings, as well as the cost of trainings. We also wanted to remind you that some organizations will provide CECs, and maybe Megan can explain this a little better than I can, but if you are someone who needs continuing education credits for licensure, oftentimes mental health first aid is honored. So Megan, could you share a little bit more about that?
Yes, yes. So when you bring mental health first aid into your organization, and I'm speculating that there's a lot of different industry types on this phone call today, whether it's, a manufacturing sector and you have different certifications, or financial education, or, you have lots of different certifications, a healthcare organization, lots of different licensures and certifications, because mental health challenges in the workplace are so ubiquitous, and it's being recognized as a barrier to work, but also a benefit to work when people are thriving and flourishing. More and more professional organizations are saying if you do continuing education, you may earn continuing education credits for said profession. A mental health first aid instructor cannot issue those continuing ed credits, but what we can provide, the course outline, the course objectives, and then the amount of time in training. So we are seeing more and more professional organizations honor 8 continuing education credits, and then that is contingent upon a person submitting that. But I'm happy to work with organizations to do some inquiring and asking questions to get, kind of in writing, will mental health first aid training count towards continuing ed credits? But becoming more and more common in professions that, are just kind of all across the boards.
Thank you. Well, this concludes our webinar for today. So I just want to thank everyone for joining us. And Megan, thank you so much for your time and expertise on this topic. Megan is one of our mental health first aid trainers. So if you were to proceed with having this benefit offered in your organization, you may see Megan again. Megan also owns her own business, and that is Hammis Homestead and Consulting. Is that correct, Megan?
Yes, yes.
So we're very grateful for her partnership with Employee and Family Resources. And as I mentioned, don't hesitate to visit our website, www.efr.org. Thanks, everyone.
Thanks.